Hello, OPRA aspirants. I guess your exam preparation is going well. Now you got only last 10 more days to sit for the exam. And this 10 days is more important for you to crack this exam. So what you need to do, what are the tips and tricks that you need to follow for this 10 days to clear your examination? So I'm going to discuss all those things in this video. Let me explain about briefly our OPRA syllabus, the blueprint, and I will go through each topic and where you have to emphasize more. Okay. Hello, OPRA aspirants. I guess your exam preparation is going well. And so far you have spent at least 3-4 months for preparing for your exam. But now you got only last 10 more days to sit for the exam. And this 10 days is more important for you to crack this exam. So what you need to do, what are the tips and tricks that you need to follow for this 10 days to clear your examination? So I'm going to discuss all those things in this video. So the first thing is revision. So revision plays a most important role in this 10 days. So what will be the things that you have learned so far? So you must keep on revising every day. So each and every day, like you must keep on revising all the topics that you have learned. Okay. So let me explain about briefly our OPRA syllabus, the blueprint, and I will go through each topic and where you have to emphasize more. Okay. So the first thing, let's start with biomedical sciences. So in biomedical sciences, you have physiology, immunology, fluid electrolytes, and lab test values. So there are a lot of other topics also there, but these are the things that you need to focus more. Okay. So the first thing is your physiology, and then your immunology, from where you can expect at least 4 or 5 questions, and fluid electrolytes and lab test. Okay. So most of the students, they ignore these lab test values. Okay. And fluid electrolytes and the imbalances, all these things that they try to ignore it, but these are the ones that also plays a major role. Then when it comes to the pharmaceutics, including the pharmacokinetics, calculations. So calculations plays a major role here. So you must keep on revising the calculations every day. You must do the calculations revisions for both pharmacokinetic calculations as well as therapeutic calculations. So we know that the calculations, they are categorized into 2 types. One is the pharmacokinetic and the other is the simple dose-based calculations. So they all come under the therapeutic calculations. So don't ignore the calculations. So keep on practicing the calculations every day. Then when it comes to pharmacology and toxicology component, in pharmacology and toxicology, well, apart from revising all those common mechanism of actions of the drugs as well as the adverse effects and so on. So you must also focus mainly on the areas, okay, adverse drug effects and drug interactions. So drug interactions definitely plays a major role in the examination. So you can expect at least a few important things from the drug interactions, at least 4 or 5 questions from the drug interactions. And antidotes, there is another topic that is known as the antidotes. So don't ignore this part. Okay, so you must also focus on the antidotes, which are common antidotes for different drug toxicities. And when it comes to the other thing, like the factors that causing the pharmacokinetic changes in the body for the drugs, like what are the factors that affect mainly in case of pregnancy, in case of lactation, in case of geriatric patients, in elderly patients, as well as in pediatric patients. Okay, how the pharmacokinetic changes that occurs. So these are the things that we need to focus more. Okay. Finally, when it comes to the therapeutics part, so therapeutics plays a major role here. Around 45% weightage is for the therapeutics. Okay. So therapeutics means like we'll study all the systems, like we'll study on the cardiovascular system, our nervous system, endocrine system, respiratory system, GIT, musculoskeletal, and all the other systems that we study, and we'll do all the MCQs in those things, and we'll focus more on those parts. But to crack the examination, apart from all these systems, so you must also focus on few other things which are included in your syllabus, like primary health care. So primary health care and the patient care. So these are the things that they have added in the OPRA examination. So you must focus even on that part as well. So you focus on the primary health care component. And health promotion and drug harm minimization. So these are the few things, like they are the minor components, but definitely you will get the questions from these things. Okay? So you also focus on these components. Okay. So you make a proper planning for this exam for this last 10 days. Okay. And what will be the things that I have highlighted? So keep on revising these things for this last 10 days. And the most important thing, at this time, you should never ever try to open any new topics. Okay? So don't try to open or don't try to go through any new topics that you haven't learned so far, okay? Because it leads to cause a lot of mess up and a lot of confusion for you. So don't open any new topics. So what will be the things that you have learned for this last 3 months or for the last 4 months that you have been preparing for this OPRA examination? Just stay with those things and focus only on those things and revise all the things that you have learned. Okay? And for those who are giving the OPRA examination and those who are wondering like where can you find any free resources for this examination, so you guys can visit to our website, so Elite Expertise website, okay, so which is shown below. So you can visit to our website, and in our website we provide a lot of free resources for the exam preparation. Okay? So thank you so much and all the best for your examination. Just prepare well and rock this exam. Thank you.